This is a demonstration of the Williams flexion exercises. When the humans became erect, they developed this sway back or lordosis. That causes the anterior or the front of the disc spaces to open up and the posterior part of the disc space to close and compress the discs. It also compresses the posterior elements. Here are the posterior spines, those bumps that stick out of the back of your center of your spine. Also the elements on the side, the joints, the facet joints also become hardened. The joints become irregular. There's bony impingement here and here in multiple areas. The premise of the Williams flexion exercises is to straighten out the lumbar spine and open up these posterior elements and do exercises in a more comfortable position and encourage the back to flatten out its lordosis. This is a lateral of the lumbosacral spine. Here's the sacrum here. Notice that the discs are nice and even. They're not opened up or closed on either end. Notice that the posterior spine elements are also separated here, so they're not touching. Notice that the facet joints are also open. This is a perfect position for the spine to exercise in. You can strengthen up the muscles and get the body used to functioning with the spine in this position, and it also doesn't cause any impingement of any of the osseous structures. So the exercises are done with a flat spine against the floor, and here the pelvis is being tilted toward the head and the spine is being pushed down to the floor. This is contracts the abdominal muscles. You do this 10 times. The second exercise, also done with the back flat on the floor and the knees up. Put the fingertips on the thigh and move your fingertips to the top of the knees. Notice that the lumbar spine still remains flat, and this is a core exercise, particularly for the abdominal musculature, to tense up or give you more strength in this area. You do 10 of these. The third exercise is to do a knee chest on one side, and notice that it's done with the other leg bent up. You hold that to a count of 3, and you do it again on the opposite side, like that, and you want to do 5 on each side. There you go, looks good. Now, notice again that the spine is flat, and when the spine is flat like this, the spinous processes in the back are not touching each other, and it relaxes the posterior facet joints. The next exercise is to do a straight leg raise. This is for stretching of the hamstrings and the low back muscles. You keep the one leg bent up and then the other one straight, and you do a straight leg raise and take it as far as you can. Make sure that your foot is kept in the dorsiflex position. And you do 5 of these on each side. Let's go ahead and do one on the other side. Remember to keep that other leg flexed. Try to do it with a straight knee as well, so that you flatten out the lumbar spine and protect the lumbar spine in the position of comfort, so the posterior spines are opened up and the facets are opened up. The final exercise is an auto manipulation. You bring both knees up. Again, notice that your back is flat, and what's happening here is you're manipulating the lumbar spine, but mainly the low lumbar spine, opening up the facets. And this is a manipulation to take the pressure off the facets one side or the other, or if you've caught a little of the lining of the facet joint, this might be an auto manipulation. These exercises should be done morning and evening, and they are not a problem if you're having back pain or even radicular pain. When you start to experience some discomfort in your low back and you feel like you may be going into a session of back pain, you can start these prophylactically. I hope this is helpful. Be sure to subscribe to my YouTube channel, and when you do so, be sure to hit the bell next to the subscribe button so you can receive future videos. Thanks very much.